Hi, I'm Dr. Karina Del Rosario, and I'm an assistant clinical professor here at UCSF. So I'm a physical medicine and rehabilitation physician. I work mostly with adults, and I subspecialize in electrodiagnostic medicine and also work with adults on musculoskeletal conditions and neurological rehabilitation. So we really focus on improving function, whether it's through injections or physical therapy or medications. And really the goal is to optimize quality of life and function, and whether they're limited by pain or maybe they had some neurological injury like a stroke or spinal cord injury. PM&R can be a great specialty for all sorts of patients. I think because we are not surgeons, but we have a really good understanding of anatomy, musculoskeletal system. You know, if someone's feeling pain or weakness, we can be the good first providers for patients to see to try and help figure out why they might be feeling pain and sort of what are the next best steps. I'm actually third generation female physician in my family, which is pretty neat. So my mom and my grandma were all physicians. So, you know, I think it definitely felt like one of those things where it feels like it's just in your genes. It just feels super rewarding to be able to give back, and it kind of feels like I was made to do it.